We're learning more tonight about the suspect in yesterday's deadly shooting at Fort Hood, and tonight authorities are still trying to figure out a motive. Thanks for joining us. I'm Renee McCullough.
And I'm Matt Templeman. Tonight, authorities are looking at Army Specialist Yvonne Lopez's mental health history as they try to get a better understanding into what happened. It's our top story here at 6 o'clock. The Iraq War veteran received treatment for depression and anxiety and was undergoing evaluation for post-traumatic stress disorder. Authorities say the 34-year-old took his own handgun onto a sprawling Fort Hood military base, killed 3 people, wounded 16 others before taking his own life.
Well, for some veterans, it can be mentally challenging to adjust to civilian life after a military experience.
KEZI 9 News reporter Chanu Hurd joins us live in the newsroom tonight with a look at some of the resources that are available here in Lane County. Chanu?
Well, Matt and Renee, student vets at the University of Oregon say the mental health between veterans vary. Some are just fine while others need the help, but not all people know about the resources out there that can help. For the second time in 5 years, a deadly shooting broke out at Fort Hood in Texas, leaving 4 people dead. Officials say they believe the shooter, Yvonne Lopez, had undergone PTSD evaluations before but was not diagnosed. University of Oregon student veteran Cody Schmidt says as a vet, addressing mental health is key to adjusting to life after service.
Knowing your resources before you get out, or even soon after you get out, helps that transition so much.
Formerly serving in the Navy, Schmidt says keeping everything to himself wasn't healthy.
For a few years, I just lived with and internalized everything that had gone on. And once I started talking to people and opening up to friends and family, it's really helped.
We all need someone to talk to, and the sad truth is some people don't have that, and some vets don't have that.
Lane County Public Health says there are more than 30,000 vets in the county, and their veteran services help with everything from providing information about GI Bills to finding help for mental issues.
You think of a first aid kit, this thing that helps us out when we're in a time of need physically. Our physical health isn't so great, so we have this thing that we turn to in emergency. And what we're trying to really advocate for and promote is this concept of your mental health is just as important as your physical health.
One of the biggest problems is stress, and having these resources just gets rid of that so immensely, and finding out about the resources is a big key to getting the help that people need to get.
Public Health says many of the people working in veteran services are also vets, so they can relate to those that they help. And over at the U of O, free counseling is offered at the health center. And Schmidt says you can also talk to advisors at the Veteran Affairs Office as well. Live in the newsroom, Chinu Hurd, KEZI 9 News.